The prevalence of malaria in Nigeria has reduced in recent years, with Lagos at the leading with the lowest malaria burden, despite its population, bringing the prevalence rate to about 3%, according to the State Ministry of Health.
Lagos truly moved towards malaria pre-elimination, which was the assumption.
Despite the progress, Lagos still records 900,000 cases annually, revealing the gap between the prevalence rate and diagnosis rate, hence a high-level convening on malaria elimination and tuberculosis diagnostic scale-up by the state government to bridge this gap.
In a nation where malaria remains one of the leading causes of morbidity and mortality, particularly among women and children, the choice of this theme is both relevant and urgent. This gathering, therefore, reflects a shared understanding that the health of our people is the foundation of our prosperity.
Now, naturally, the prevalence data is data that is given to us by very established institutions like WHO, the National Malaria Elimination Program. When they give us these figures, they are correct, they are sound, they are checked, and we have no problem with them. However, on the malaria test positivity, there are issues.
Research shows that 95% of fever in Lagos is not caused by malaria, a situation experts refer to as malaria-negative fever, leading to a policy of mandatory testing and proper diagnosis of malaria before commencing treatment.
We all think we know what malaria is.
Health experts' recommendation to diagnose malaria using a rapid diagnostic test remains most efficient in getting results.
We believe that at primary healthcare level, RDTs should be used. But it doesn't mean we're going to do away with our malaria microscopy capacity, because that must also be established. It must also be established, but we understand there are limitations because you need staff that has been trained. You also need to have the infrastructure.
If we left those 95% of people without any clear referral pathway, we would end up with incorrect or inappropriate antibiotic use. We would have people who wouldn't believe the test and would believe that they actually have malaria because I know what malaria feels like in my body. We would misdiagnose for health issues that were coming up in the state that we needed public health interventions around. This has been spoken about.
Beyond emphasizing over-diagnosis and mistreatment of malaria in Nigeria, particularly in Lagos, the conversation at the meeting focused on the importance of harnessing technology to improve health outcomes across the state. In Lagos, for News Central, Omolola, Ololade.